because somebody pretty much in every family is being inhibited in their life by pain. And so we have an exciting opportunity for people to get out of that pain non-invasively. We have a number of technologies, and one of them that we want to talk about today particularly is called Scrambler.
And now, America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to our website, americashealthcareadvocate.com. It's my producer's day, Mr. Dave Thiessen. He's our HIA radio producer and does all of the video work that you see up there in our 16 podcast channels and that YouTube channel. With now 623,000 views, we really appreciate all you out there downloading the show and listening to it or listening to those podcasts. And Gardner Cowdery, he is our cumulus producer behind the board here that makes all of this sound the way it's supposed to sound. And we're happy to have him on board today. All right, if you are looking for Obamacare or you're looking for Medicare, you're chronologically challenged, or you're a 1099 employee, you might want to think about giving Carol Lee Steele a call over at RPS Benefits by Design, 877-385-2224. Once again, if you're a 1099 employee and you're looking for decent health insurance, health benefits that are going to cost less than ACA, give Carol Lee a call, 877-385-2224. And on the group side, there's some great benefits out there that Maria Allers, who is the president of RPS Benefits by Design, be happy to chat with you about as well. Once again, that phone number, 877-385-2224. Joining me in studio again, once again, Dr. Arden Andersen. Doctor, you're becoming quite a pro at this. What is this, our fifth or sixth show we've done now?
It is.
Yeah, so we're happy to have you back in studio with us. And the CEO of Radiant Pain Relief, Brenden Lundberg. Welcome to the show, Brenden. Glad to have you here.
Great to see
Came in
you.
from Colorado just to do this show today. So
I did, yes.
We greatly appreciate that.
My pleasure.
You know, we're going to talk about Brand New Day, and their website is brandnewdayhealth.com. This clinic has done more to help people that I've had on this show that are friends of mine, that are people that I know personally that have gone to this clinic for care. And what they're offering, the Neuro 20 suit, the Scrambler you're going to hear about today, the red light, blue light treatment, all the different things that they're doing there. No meds, no surgery, no invasive procedures whatsoever. It is remarkable. I've sent multiple people there that are friends of mine, colleagues of mine. I've had people on this broadcast. So I urge you, if any of these issues, we're going to talk about Parkinson's today. We're going to talk about pain relief today, neuropathy today. We're going to have a whole host of issues to cover. This is a great opportunity for you to listen and learn. So, Doctor, let's just start with you and a little bit about Brand New Day and what's going on now. You know, every time we do one of these, we've got some new technology device or some new treatment that we're doing. And, you know, I'm talking to people who are doing it and they're like, I can't believe this. It's changed my life. Take it away, Doctor.
Yes, thank you very much, Carrie, for having us. It certainly is a brand new day. It's an exciting brand new day. That's just not a play on terms. I mean, it really is. Pain is one of those things that affects most people in the world, really, at some point in time in their life. And unfortunately, it seems to be more and more of a problem as people get older, just because of arthritis.
You're looking at me when you say that at age 76. I want to point that out.
Yeah, right. But it's, it's part of life, really.
Yes,
we have accidents, we have athletic injuries, we have just osteoarthritis, we have diabetes, we have all of those things. And pain is pretty much a part of every family's life, because somebody pretty much in every family is being inhibited in their life by pain. And so we have an exciting opportunity for people to get out of that pain non-invasively. We have a number of technologies, and one of them that we want to talk about today particularly is called Scrambler. And I'll let Brenden explain a little bit more about that when we get to him. But Scrambler is one of those things that really reprograms the brain, because if we're in chronic pain, it's one thing to be in acute pain. You get in an accident, you break your arm or something of that nature, it heals, and you're out of pain.
Right.
It's a whole nother thing, though, that you break that arm, it heals, you go to physical therapy, And you get your range of motion back, but the pain is still there. And 5 years later, that pain is still there, or maybe it's even worse now. So that is really negatively affecting a person's life. And they may have been back to the surgeon, they may have been to another physical therapist, they may have had all kinds of filming done on it, and nothing shows up that invasive technologies will do anything about. Gee, go home, have a nice life.
No, go home and here's your meds.
Yeah, right.
Don't leave that out,
Absolutely.
Doctor, because
correct.
the solution we get in the medical community is here's your meds.
Absolutely. That's correct. And, well, here's the latest, greatest med on top of the already 2 or 3 that you're on. And the problem is that basically makes the patient a zombie.
Yep.
And that's not acceptable either, because that even inhibits their quality of life even further. So what we found is that pain chronically has created a pattern in the brain to expect that signal every single day, 24/7. And so even if we were to do something locally in that arm for the pain to go away, it's been in the brain for so long, the brain thinks it's still there. And so it still registers as a pain. Perhaps the best analogy I can give is people who have lost a limb. They get what's called phantom pain. Well, the limb's not there anymore. How can you possibly have pain in the hand and the hand's not even there?
A lot of veterans go through this.
Correct.
Yeah.
It's because the pain is in the brain.
Right.
That signal that there is a problem here is in the brain. What Scrambler does is help to reprogram, reset the brain to relax, basically, regarding that pain signal. And think or understand, if you will, that signal is no longer there, creating that pain pattern. And so people that have been in pain chronically, for example, we had a lady come in, 5 years of chronic hip pain. It wasn't an issue that required a hip replacement. She didn't need that. She'd already been released from her physical therapist. She's got all kinds of range of motion, not a problem there, but she still has this pain. She says to the point of 8 to 9. We use a scale of 0 to 10.
Yeah.
She's at 8 to 9 every day, which means it completely occupies her life. 3 weeks of treatment with the Scrambler, she's at 0 to 3, depending upon what activities she does. She is happy as a lark.
That's amazing. It's absolutely amazing. And you know what I find even more amazing is that this is not new. This has been around since 2009. You have to ask yourself, where's the medical community been this whole time? And that's why, when we come back from this segment, we're going to talk to Brenden, and we're going to talk about the technology, what's gone into this, and how they're pioneering across the country. But this is what I'm talking about when I talk about alternative methods that can change your life. And they do this at Brand New Day, and they do it every day. And I've got personal experience there, okay? I've got friends that I send there. If you know somebody that's dealing with what Dr. Andersen just talked about, I don't care where you are in the country. We have people come in here from all over the country to go to this clinic. Go to their website, brandnewdayhealth.com. brandnewdayhealth.com. They'll be happy to chat with you, set up a consultation. Dr. Andersen will talk to you, and they'll tell you what they can do for you. And there's a lot more to it than Scrambler. There are other technologies we're going to talk about today that they use as well. So we'll get into all that as we move on with the show. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Once again, that website, brandnewdayhealth.com. brandnewdayhealth.com. Stay right there. Don't go anywhere. Doctors are in the house. Welcome back to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. In the studio with me, Dr. Arden Andersen and Brenden Lundberg. He is the CEO of Radiant Pain Relief. And now we're going to talk about this technology you just heard Doctor talk about in the last segment. So let's start with this, Brenden. How did this all come about? And it's remarkable what it's doing and the people that it's helping. So just talk about the genesis of this. You shocked me on the break when you said it had been around since 2009.
Yeah.
And I'm like, why isn't anybody using this?
Yeah.
So let's talk.
Yeah, the Scrambler Therapy was FDA cleared in 2009. It's been researched at Mayo Clinic, at Johns Hopkins, at MD Andersen, some very reputable institutions globally.
I would say so.
Yeah, and yet it's been lost in obscurity, in part because of economics. I mean, economics drive, like how the providers make money, how the system makes money, and Scrambler Therapy falls out of that because of the way it was taken through the FDA. It was predicated on a TENS unit, which is therapy that's been around since at least the 1960s, right, Dr. Andersen?
Yes.
And yet it's very different. Its mechanism of action is quite different, and its outcome is very, very different as well, because it's creating, rather than just temporary relief, it's creating more of a lasting or durable pain relief
Doctor
experience.
just described.
Correct. Yeah, it really goes, the fact that it's based upon the most modern scientific understanding of pain and chronic pain in particular, which is that it's the brain. Pain is a protective mechanism. It's the single greatest human common denominator. Everybody, as you mentioned a minute ago, rich, poor, every race, creed, color experiences pain.
Yep.
Right? And it is actually a protective mechanism. When we have the hand on the hot stove, or we've broken an ankle, or God forbid, we have cancer growing in our tissue, we actually want to feel pain in those circumstances because it gets our attention. It cuts through the noise of life. It says, hey, something's not right. It encourages us to learn to not touch hot stoves, and it protects us, right? And we seek care because we feel something that's uncomfortable. However, when pain becomes chronic, the brain becomes wired or habituated to expect and to perpetuate pain. As Dr. Andersen said, much like a phantom limb pain, it's not about the tissue anymore. It's about the nervous system becoming wired to expect pain. The tissue is then reacting to that. So rather than masking the pain with a drug, which is what most doctors are prescribing and doing, or trying to inject something or surgically repair or put in a spinal cord stimulator, something that's much more invasive, this technology very calmly, very safely helps retrain the brain back to a more normal perception of pain. We're not making people superhuman. We're not taking away their ability to feel pain. We're not going to have them be crashing through walls and not feeling that pain, but it's going to help them be a more normal pain experience in their body. The way that it does that, and the reason it's called Scrambler Therapy, is based upon a dynamic and changing, i.e. scrambled set of artificial nerve impulses that are generated in the device and transmitted through the body via skin surface electrodes. We don't place the electrodes typically on the pain area, but rather around the pain area, and we transmit this information through the nervous system, which the brain receives as kind of an endogenous or a self-generated nerve impulse. And then the second it receives it, it's changed, scrambled, and resent. Changed. So over the course of an hour or so of treatment session, the brain is flooded with a dynamic and changing set of information, which it can't interpret, it can't understand it because it keeps changing. But because of that, it wants to know, what is this message I'm receiving? Is it safe? Is it information that's important? Is it a threat? It doesn't know because it keeps changing. And so as it works to try to interpret that, it starts to reallocate focus or energy. And there's a saying we've probably all heard: what we fire, we wire. Right? It's a habit kind of. And the brain has been in a habit, it's created these grooves or these myelinations that have perpetuated pain. As it goes through this process, something called neuroplasticity, the brain can change. And so in the first session, typically we'll see some level of relief, but it's really through a series of sessions over time, and it could be 10 or 15. We recommend daily sessions for 2 or 3 weeks. And through that process and through neuroplasticity, the brain can go through a restorative process. What also happens, because this is a process, not just a one-time procedure, but it's a process, is that the person immediately, typically night one, starts to sleep better, which is hugely restorative to the nervous system, right? I mean, most people in chronic pain aren't sleeping well through the night, or they're on medications that are artificially helping them sleep. So sleeping improves. Then as that starts to happen, they start to feel better. They start to maybe need their medications that they're on less. They can start weaning down and titrating off of those, which probably helps them feel better. And maybe even most importantly, hope starts to return. As they can start to feel better, as they can start to move better, as they can start to have better mental clarity because they're not on these medications that are complicating them, they can interact in their world with their loved ones, with their kids, with their job, with their hobbies. Hope starts to return, and that becomes a hugely powerful catalyst to helping them continue to improve as well.
That's fascinating because my wife had a heart attack here about a month and a half ago. She's been dealing with heart failure for the last 6-7 years. And we had some remarkable news when we went to see our cardiologist about a week ago, and our surgeon who was she was prepared to do this surgery. They were going to do surgery. Sorry. They came back and said, your ejection fraction rate is at 54 now. You're at the low end of normal. You don't need any of this. When you talk about psychological difference, she was like a 16-year-old girl, okay? Because mentally, she had hope now that she was going to be able to live a normal life with her 6 grandchildren and move forward. So the psychological, I don't think people recognize the psychological impact. Now, the other part of the problem is, and you alluded to this, okay, the reason why I think a lot of this doesn't get adopted is because the pharmaceutical industry, and look, I'm not anti-pharmaceutical, but let's be clear. There's a hell of a lot of money being made selling medications. Okay?
Yeah.
And the doctors are getting paid, the companies are getting paid, the insurance companies are getting paid, believe it or not. Okay, there's a lot of money flowing here.
Yep.
So, eliminating the need for Oxycontin and other pain relief medications by using a technology like this.
It's a threat to the system.
Thank you very much.
It is, yeah.
Okay, and it's out of the box. And because it's out of the box and it's a threat to the system, then you're not necessarily going to see it adopted. And that's why, what Dr. Andersen and Steve Sanborn have set up at Brand New Day is so very, very different.
Yeah.
How many other clinics do you have this in around the country?
Well, there's a handful. I don't know the exact number. I was given...
But it's not pervasive throughout the country because it's not being adopted.
Yeah, the consumers haven't heard about it because nobody behind it has been able to market it to them in a very broad way. Physicians don't understand it in many cases because they're not trained on the science that underlies it.
Or don't want to understand it.
Maybe. I think many physicians want to do the right thing, but they also have an economic reality. They have to, feed their families and keep the lights on and pay their staff.
Of course.
They're going to do the things that generate revenue for them, and that's insurance-based prescriptive medicine in most cases, or injections. Even though the steroid injections, Dr. Andersen can clarify this as a physician, but I think the literature is now showing they accelerate the degeneration of the tissue. They're actually making the person worse, even if they're giving some analgesic benefit short term.
You're getting instantaneous relief that's going to last a very short period of time, and then you're right back in the box again.
And that's why I think Scrambler Therapy is so powerful, because it is a process, again, that becomes empowering to the individual to where they can reclaim their life.
And that's remarkable. If you want to learn more about this, maybe you're a physician and you'd like to learn about it, go to the website, brandnewdayhealth.com, brandnewdayhealth.com. They'll be happy to reach out to you and chat with you about this. If you're someone that in pain, or one of your family members is in pain, or a good friend of yours, please, I urge you to go to this website. I've sent lots of people to this clinic. They've had great results. When I come back from the break, we're going to talk about Parkinson's now, neuropathy, and some of the other things that they're treating at Brand New Day. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast, across the USA. Stay right there. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. In studio with me today, Brenden Lundberg. He is the CEO of Radiant Pain Relief, and Dr. Arden Andersen from Brand New Day Clinic. And if you want to know more about that and what they do there, that website is brandnewdayhealth.com. So, Doctor, we've had some pretty remarkable people come on this radio show that you've treated. But I want to start with Parkinson's, because this is a disease that that affects a lot of people. It's being treated with medications. You've got a totally different way of treating this. It's a Neuro 20 suit. I happen to have one of these suits, and I use it for conditioning and working out. But talk about the Neuro 20. We brought the suit in studio. We've talked about it. Talk about that and how this, along with the other treatments that you've got, the light treatments, the Scrambler treatment, the effect it's having on Parkinson's patients. Because some of this stuff is just remarkable to me to even hear about.
It is, actually, and it's very exciting. Parkinson's is extremely devastating, and the problem is the numbers just keep going up. And so the problem is that conventional medicine is only looking at either stem cell therapy, a drug, or surgery to address the Parkinson's issue. So essentially, really all they're doing is they're looking at how do I address the symptom? And nobody is really looking at, well, what's the electromagnetic process that's gone awry? So what we find is that if we can wake up that nervous system again, and this is where the Neuro 20 suit comes in, because the Neuro 20 suit, even though it's on the body, the long and the short of it is it's actually stimulating the central nervous system and back to the brain,
right,
stimulating brain-derived neurotrophic factor, which 20 years ago, we did not believe that brain cells could be regenerated. We thought it was impossible. And, well, there was a few people, Robert Becker for one, who discovered that it was possible to do that. But nonetheless, conventional medicine. And still today, there's a broad spectrum of opinion that, well, you can't really do too much about it. But what we're finding, and there is a clinic now in Europe that is associated with Steve and us that is following this protocol. And we now have the longest Parkinson's patient on the Neuro 20 suit protocol continuing to improve over time. And this clinic is exclusively treating Parkinson's patients successfully. Now, there's a number of things that go into that because Parkinson's is an expression of an overall issue going on in the body. So there's, why did they get it to begin with?
Yeah.
What else may be associated with this? Do they also have some dementia? And long-term, most all Parkinson's patients get a little dementia.
Yes.
Do they have also a cardiac issue going on? Do they have maybe diabetes? So what other chronic illnesses do they have with that? Because we need to address all of those things. And one of the things that Dr. Palermo, who has really pioneered a lot of this as the medical director regarding their Neuro 20, is that it's one thing with a disease like Parkinson's to treat it and get improvement. It's another thing to maintain that improvement. And that's where nutrition has to come into supplementing particularly brain nutrition in order so the Neuro 20 suit stimulating the brain-derived neurotrophic factor holds and continues to progress. But we're talking about improving their, not only their strength, but their coordination, reducing or eliminating their tremors, getting their personality back, because one thing that we see with Parkinson's patients as they decline is they get a very flat affect, they get very ratchety in their gait, and then
they lose the ability to walk.
And then they lose the ability to walk.
Right.
Absolutely. They're there. You know, you can see them, they're there, but they're not really there, unfortunately, because the brain's not working like it's supposed to. So the Neuro 20 is making progress in reversing that whole systemic illness.
So describe the suit. I want people to understand. This is like a wetsuit. It looks like a surfer's wetsuit.
It does. It looks like a wetsuit
That's
or a diver's suit.
Yeah.
And it has pads on the inside of it where it is lined with silver. And so there's also a little bit of an antibacterial component to it just because it's silver. It is then by Wi-Fi hooked into a unit that through the computer generates the signal.
And the computer is like an Apple computer. I have one.
That is correct. Or an iPad.
Yeah, iPad.
And it generates a pulsed signal. And the pulse is the key to getting this brain-derived neurotrophic factor to be stimulated in the central nervous system. And so it is unique. It is cleared through the FDA.
Correct.
As a medical device, so it requires a prescription. It's not like going to Body 20 and putting on a unit to gain strength.
Yeah.
That all it is a muscle stimulant unit. This actually is a central nervous system stimulate. That's different than stimulating the muscles, because it's the brain, it's the central nervous system that we have to change.
And the computer that you get with the suit, which you set up the therapy after they go through a series of sessions, learn how to do it. They can buy the suit, the computer, and they can take it home, and you can show them or program for them progressive treatment so they can keep, because as you said, with Parkinson's, it's a continual effort.
Correct.
So this is something where someone can actually take the suit. I have one. My wife has one. We use it for different reasons. But the point is, you can take it and program it to do whatever you need it to do. Can you talk about that a little bit?
Yes, that is correct. Well, it depends upon where you're at. And what we see with Parkinson's is that most of these people are exhausted because constantly the shake burns a lot of energy.
Right.
And so with a Parkinson's patient, as compared to, say, myself or yourself that doesn't have Parkinson's, you have to go much slower. The signal has to be much weaker. We can't have the intensity to it, because what happens is we'll blow through their ATP long before we get any therapeutic benefit on that. So that's also why it's vital that we supplement them in order for that therapeutic aspect to be beneficial. So we have to go real slow, starting out very slow, and the brain then starts responding positively, so we begin to get additive benefit with each therapy, as opposed to if we go too fast, we then go the opposite way, because we, like I said, we just blow out their energy, and it doesn't work that way. And so that's just something that has been learned over time in treating Parkinson's patients. Each one is going to be a little bit different as far as what can they tolerate, because how early are we getting them in their disease process, for one thing, as well as what kind of diet do they have? What kind of body health do they have? As I said, what other chronic diseases do they have? Because those things also steal nutrition from them. So each one really has to be customized and then change as they change as well.
And that's the beauty of this suit and the beauty of what it can do. It is quite remarkable. And I have seen the results in this on people who have come into the show. We come back in the next segment. I'm going to ask Dr. Andersen to tell the story of a man who came in here from Washington, D.C., who had drop foot, who could not walk without a walker. And he walked through the door of this studio and sat in the same chair that Doctor's sitting in right now. And I want him to tell that story about how that suit and this treatment changed his life. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network. Now, I urge you, if you know anybody that's got Parkinson's in your family, in your church, at your place of work, and you want to help them, have them go to the website, brandnewdayhealth.com, brandnewdayhealth.com. People are coming in here for these treatments from all over the country. This works. I wouldn't have it on the show, and I sure as hell wouldn't endorse it if I didn't believe in it. So I'm urging you, brandnewdayhealth.com. Stay right there. We'll be right back after the break. Welcome back to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. I want to give a little shout out to our newest affiliate, WRHI AM and FM 100.1 in Charlotte, North Carolina. We're actually on for 2 hours every Saturday there. That's pretty remarkable. We thank you very much. Very happy to have you on board as part of the America's Healthcare Advocate family. In studio with me today, Brenden Lundberg. He is the CEO of Radiant Pain Relief, the company that does the Scrambler. We're going to talk a little bit about that and ask him to recap that. And Dr. Arden Andersen from Brand New Day Health, the clinic here in Kansas City, actually in Lenexa, that provides these services that we're talking about that are very different than what you're seeing from a typical physician. So this is all these therapies. They're non-invasive. There are no drugs involved. There are no surgeries involved. It is remarkable what they can do. I know because I've sent many people there and they've had remarkable results. I want you just to recap a little bit about Scrambler again and this whole pain management thing, because it is a huge issue. And as Dr. Andersen said, everybody knows somebody in their family or friend that's going through this. Brenden?
Yeah, if you're listening and you're dealing with pain, or someone you care about is dealing with pain and it's affecting their life, come to Brand New Day. I mean, this therapy is safe. It's consistently effective. It creates lasting relief. It creates empowerment to that individual back into their life. And I spent the last 15 years working with this technology on the clinical care side, as well as on the physician education side. If you're interested in adopting this into a clinical practice, please reach out to us via the Brand New Day website. I'm honored. I think Brand New Day is the only clinic in the Midwest between Chicago and Texas that has this therapy.
That's amazing.
Yeah. So
that's why we've got people coming in here from all over the place.
100%. And they're doing amazing things at Brand New Day. I'm really, really impressed. And, while pain has been where I've focused the last 15 years of my life and career and passion, my dad suffers from Parkinson's. So I've been keenly aware and taking notes to Dr. Andersen's comments, and I can't wait to get my dad hooked up to this.
I would urge you to do it, because I will tell you, I've seen the people, that have come in and gone through these therapies. And I want to switch to a story now, Dr. Andersen. I'm sure you remember. We had a gentleman come here from Washington, D.C., and he walked in the studio. He had a little bit of a limp and didn't have a typical normal gait. And he sat down and he had drop foot. And he told me before the show started that he had been in a walker and could not move without being in that walker until he came to Brand New Day. And he came in here and did this radio show. I want you to talk about that and how you were able to basically eliminate the drop foot. He was 90% better when I saw him, and he was going through another week of treatment with you. So I'm most curious to hear how he is now, but tell the story.
Yeah, that's a very nice story, really. He had a spinal cord injury, post-surgery, left him with bilateral foot drop, and to the point that he had to wear, he had to wear braces on both ankles and feet to hold his feet from just dropping, and then he had to use either crutches or a walker to walk. So he was not real ambulatory. And particularly for him, because he was formerly a semi-pro or pro soccer player.
I remember that. Yes. Yeah.
And so very active man.
Yeah.
Extremely. And for him not even to be able to walk normally just devastated him. Well, there was nothing that anybody could do conventionally for him because he had an injury to the spinal cord. He came here, heard about us, and put him in a suit. And even after the second treatment, he had more control of his feet and ankles than he had prior to surgery. And so he was really excited about it. And it continued to progress to the point where he didn't need the crutches anymore. As you saw him.
He walked in this studio.
Correct. That's correct. And he was able to graduate away from having the braces as well. He couldn't run, but he now had some mobility, normal mobility back.
He had quality of life,
He had quality of life to get back to those kinds of things. And so he continued to progress through that next week. And then went back home. And so foot drop is one of those things that we are seeing more of, actually, because people are getting that information out. We recently had a woman out of state who came to us with several things. One, she had foot drop, but she had foot drop because she had such significant neuropathy and pain that she was losing muscle strength in the legs, and so she was having foot drop because of that loss. Completely disturbing her life. She couldn't sleep well anymore. She was not able to do her chores around the home, and it was affecting the whole family as a result. The first thing that we focused on was pain, because we can get to the neuropathy and the foot drop and so on with the Neuro 20, but pain was the most important thing that was affecting her life, her sleep and so on.
Correct.
By the time she left, she was pain-free and went back home. And so that helped convince her that, yep, we need to move forward and address other things with that.
And you were using the Neuro 20 suit for a lot of this, correct?
Correct, but we also added the Scrambler,
right,
and there's
the light treatment.
And the light treatment. There's another therapy as well we use. But we decided that pain for her was the first thing we had to address in order to improve her quality of life.
Correct.
Because even if we got rid of the neuropathy, that was not the primary thing that was a negative in her quality of life. It was the pain that was the issue.
Right.
And so now she's excited about moving forward and addressing.
She has a new quality of life.
Absolutely. And one thing that I wanted to mention about the Neuro 20 as well is that we're stimulating brain-derived neurotrophic factor. So it's also beneficial for athletes that have been injured because we can actually put a program in for their running, for their throwing, whatever it is that they're doing to help reprogram the brain to bring back a more coordinated response post-injury.
I work out 3 times a week. I wear that suit every time I work out. It has made a big difference for me. It's made a big difference for my wife, who has neuropathy and other issues. But thank you both for being here. Thank you for coming in from Colorado to do this show today. Doctor, as always, it was great to have you on.
Thank you. Pleasure.
You know, I'm going to close the show out. I'm just going to tell you, okay, you have to understand, you have to see this to believe it and understand what they can do. I don't care whether it's Parkinson's or it's pain management or it's drop foot or it's neuropathy or it's wound healing. I can go down the list of people I've had on this show and what they've been able to do, and it's remarkable. The clinic is brandnewdayhealth.com, brandnewdayhealth.com. I'm urging you, if you know anybody that is having these kinds of issues, reach out to them. Come into town. If you live here in the Kansas City metro, it's easy. But if you're not, if you're from, Mississippi or Alabama, or you're from California, whatever the case may be, reach out to Dr. Andersen, Steve. Go through a process where they can tell you what your issues are and what they can do to help you. It may change your life. Thank you for listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network. Goodbye, America.